Hello, welcome everybody to the No Normal Show for Thursday, December 10, 2020, brought to you by Revive Health. This is our weekly deep dive into how hospital and health system marketers can navigate what we call the no normal. I'm Chris Bevelo, Health Systems Practice Lead at Revive Health and your host for this show. I'm joined by Chase Kleckner, Senior Marketing Manager at Revive Health, and our show's producer. Hey, Chase.
Hey, Chris. Good to see you as always.
Good to see you too. Also great to see an old friend, Dana Allen. Dana is our guest today. She is the SVP, Chief Marketing Communications Officer at Norton Healthcare. Dana joined Norton Healthcare in 2008 and has direct responsibility for key branding initiatives for the organization. Dana also oversees the Marketing Communications Department, which is responsible for physician, children's, and system marketing, creative services, digital marketing, including web, mobile, and social media, public and media relations, and the system's internal communications. Hello, Dana.
Hi, Chris. Hi, Chase.
So glad you joined us today. Thank you so much.
I'm glad to be here. Thank you.
Yes, I'm really looking forward to diving into today's topic because there's so much we can talk about. So just before we get to that, some housekeeping notes. If you're new to this podcast, this is the show where we share industry trends, research, stories, information, whatever we think is valuable for those of you in the health system marketing and communications function to help you navigate what we call the no normal. I mentioned that before. If you want to know more about what we mean by the no normal, probably self-explanatory, but if you want to know more about how we think about it, some of the principles by which we approach the no normal ourselves, check out a blog post that Chase will post a link to in the chat function of Zoom. Speaking of the chat function of Zoom, use that if you want to communicate with other folks during the show. Chase will use that himself, as I mentioned, to post links to things we're talking about. If you have a question, though, for Dana, for myself, for Chase, as we go through, please put that in the Q&A queue in Zoom. That's what we monitor to make sure that we are answering whatever questions folks have. And we really encourage you to have questions for us. We want this to be as interactive as we can, knowing the kind of format we have here. So the best way to do that is shoot us questions and we will answer them as we go or at the end. Also remember that you can subscribe to this show as a podcast on iTunes or wherever you listen to podcasts. And we will also be posting recording this episode, a video recording, by the end of today. So you can share that around or revisit this if you're not seeing it, but just listening. You can find that at our website at thinkrevivehealth.com/COVID-19. Really, I don't want to get too deep in any news because I think our topic for today is social and racial injustice and health disparity issues. And we're so grateful for Dana to be willing to join us and share what's going on at Norton Healthcare because this is a difficult topic, but it's so important for all of us to understand in our roles. And so I just really want to dive right into that. The only thing I'll note is last week we had Sean Young, who Dana, I know you know Sean, and we unfortunately had crossed 3 really bad thresholds in terms of COVID-19 that we talked about. We crossed another one yesterday for the first time, at least as reported by Johns Hopkins and the New York Times and other reputable sources. For the first time, we passed 3,000 deaths in a day from COVID-19 yesterday. So again, this continues to get worse, and we know it's going to probably, if I've been tracking this right, Friday is usually the worst day for reporting of the week. So we still got today and tomorrow to go. It's not going to get better, anytime really soon. So that's just kind of the background for a lot of what we're going to talk about, because that is part of what we have to deal with health disparity right now. But Dana, let's just dive in. Let's talk about where you guys are at. And maybe you want to start by just giving people some background on Norton Healthcare overall, so they have that picture.
Sure. I always like to have some context because I'm always comparing my size to whoever's telling the story. So I appreciate this part. Norton Healthcare sits in Louisville, Kentucky. We have 5 hospitals that actually sit in one county. And if you think geographically, we have the Ohio River to our north, and then I-65 splits us down the middle. So really, when you talk about Louisville, it's kind of east-west and then maybe southeast-southwest. We're about a $3 billion net revenue. Like I said, we have 5 hospitals. We have 16 immediate care centers, 250 physician offices, and over 2,000 employed medical providers. And about 400 of those came to us right at the beginning of March when we employed the pediatric practices from the University of Louisville. So this has been just sets the stage for what we thought last year. My team, when we were trying to onboard all these new physicians and build out the website, I said, you know what, in 2020, we're going to catch our breath and we're going to just become really brilliant at the basics, and totally jinxed us because it wasn't 2 weeks later when COVID raised its head. And as an organization, we worked, I think my first day in the office without a break. I mean, seriously, Saturday, Sundays was mid-March through the 4th of July. We were doing daily videos for our employees with our CEO, and it was a lot. And I know I'm talking to an audience of people that understand that, and it's so I applaud everyone for all the great work that's being done, especially as we get ready to launch vaccines, which is the light at the end of the tunnel for us right now. But boy, it's still a long way to go. Anyway, so that's who Norton Healthcare is. I joined in 2008, as Chris mentioned. I grew up in the liquor business and naively thought how easy it was going to be to come to healthcare, and really have learned so much, which has been great. And actually, I've learned a lot through Chris, and that's how we became friends when I read his first book. So.
You were at the very first Joe Public retreat.
Yeah.
I don't even know what year that was, 2012, maybe?
I have no idea.
It was a very, very intimate affair. There was like maybe 12 of us there.
Yes.
And it's grown into something much bigger, and it's still an amazing experience. But you were there. You're an inaugural Joe Public retreat attendee.
Yes.
So,
and it was
so yeah. So thanks for the background. And obviously based in Louisville, Louisville, unfortunately, has some history to it, right? In terms of racial justice and inequity, going back to Martin Luther King Jr., obviously. But there was a documentary that was done a few years back that looked a little deeper at the differences between classes in the market, as other places too, but related to health. So why don't you kind of set the stage there and talk a little bit about the organization and that documentary, and that will bring us up maybe talking about what's going on today.
Yeah. Hey, Chase, if you don't mind putting up the one slide, that would be great. So there was a documentary done by PBS that was called Unnatural Causes. And they actually came to the Louisville market and they did a profile. It's actually on Jim Taylor, who was head of the University of Louisville Healthcare at the time, and 3 of his employees, and basically where it showed that wealth, class, zip code can really define your health, which was it's such a sad commentary. And just for a little more context, at this time, when I told you about how Louisville our market is set up, West Louisville is where the most disadvantaged population lives. And in that area, we had 2 things going on. We did have one medical practice that sat at the very, the most southern edge of the West End, barely in the West End. And we had a mobile prevention unit that was going around in that area, providing free services. And that was kind of where we were. We, as most of you all know, in healthcare, the margins are very, very narrow. And Norton Healthcare acquired some hospitals from HCA in the late 90s. And we've been on a huge growth spree. I mean, for about 10 years, where we're trying to get ourselves settled. And most of the new things that we were doing were actually going on out in the far east end of Jefferson County, where is the most privileged, I guess you would say, where we would where we would generate revenue because people are commercially insured. So we built a new hospital. We opened a new cancer center. That's where we put our neuroscience institute. That's where we put our orthopedic and hand institute. All these are new things. We built a new children's medical center out there. All things that could drive revenue. And then in 2017, Russ Cox, who actually hired me to come to Norton Healthcare, was named CEO. And that's when things began to shift. And Russ, one of the first things he did was announce a new practice in the West End. There was a community project coming together with the YMCA and one of the banks. And we came in as the healthcare partner. And I think that word partner is really important as we talk about this initiative, because this journey to address racial injustice in healthcare is going to take some really good partners to get it done. So he announced that practice and has been, since that time, has really been on a journey to address opportunities to do things better, and a part of our county that has, or just even our city, that has gone neglected for far too long.
Yeah, and I mentioned, I said Louisville has a unfortunately negative past. That's not really fair to call Louisville. I mean, I'm based in Minneapolis, so hey, we've got our own past. There's probably not any market, to be honest, that doesn't have issues when it comes to racial injustice or health equity. This is it's not a Southern problem. It's all over. Do you want to talk a little bit more about Russ and his vision?
Sure. Russ is really making his mark as someone who's being incredibly approachable. He will turn up in the most unexpected places. We are running on weekends, we have 2 drive-through clinics, one in the West End and one, we built basically it's like the Jiffy Lube of express testing that we, had the idea in March, and we opened the doors, or I should say, opened the bays in November. He'll show up on Saturdays and visit those things. If we're doing a community outreach, he's really quite remarkable and has a very empathetic heart. I will also say he's incredibly competitive and has high expectations, runs fast and hard, and we're all expected to keep up with him. So, which is exciting and nerve-wracking at the same time. But and we're going to get to this, but so we announced the West End location. We've opened that West End location. There was some blighted space in our West End that the Louisville Urban League said, you know what, we've been ignored for too long. We're going to do something really good for the community here. And they bought this land and said, we're going to build a world-class track. It's going to be an athletic and learning complex where kids can come, but we're also going to host collegiate events, and we need a partner. And Sadiqa Reynolds, who's the head of the Louisville Urban League, is a friend of Russ's, a friend of she's a great friend of the community. She's a tough nut though. She doesn't let you off the hook easy. And she came and she said, you guys need to be a part of this. And so we committed $5 million to, and with naming rights for the athletic and learning complex there. So now we've got another space there, and along with that commitment means that when they build out the retail space, we will have a practice there too. And so we've got a new practice on Broadway. We've got the urban track coming, and then Russ. If I could go through, if you don't mind, I'm just going to say. So we had March, right?
Yeah.
The first of March, we're celebrating bringing all these doctors over from ULP, and then mid-March, COVID comes. And then on March 13th, Breonna Taylor is shot. And I know everyone has heard Breonna's name. March 14th, we go on lockdown. And on March 16th, that's the first day we produced our first video. April's a total blur. And then on May 25th, in Chris's market, sadly, the George Floyd incident happens. And because of George Floyd, protests actually began in Louisville. The tape is released of Breonna Taylor's boyfriend, and it's so disturbing if you haven't heard it. At least to me, it is. And so the protests began in earnest in Louisville, and it's really, it's things are crazy. You know, I didn't know this, but I learned that, you know, within healthcare, a lot of nurses are married to people that work in law enforcement. So it was a very conflicted time, right? Blue Lives Matter, Black Lives Matter, where are you going to stand? And it was on June 5th, which was Breonna Taylor's birthday. And I went to my CEO because, you know, we were on COVID lockdown, can't go out into the public with all the protesters. And I just asked, I would like to work with 2 other employees to host our own little memorial for Breonna today. And so for 8 minutes and 46 seconds in our we have 3 buildings, and this is where our executive offices are. I thought I might have 12 people show up to join us in this 8-minute tribute to Breonna Taylor and support of those who, you know, for our employees who are feeling really, so much emotion around what's going on, and ended up having over 100 people show up, and it was really quite remarkable. And it was really the first time that I realized the importance of being able to have safe, uncomfortable conversations within our walls. And that's a really big deal. And so it was 10 days later that Russ Cox says, you know what? I've been thinking, and I didn't talk to anybody about it, and I don't care, but we're launching 5 health imperatives. And here's what they are. And there were 14 of us that the people, we'd have all been locked down for all these months. And he went to a whiteboard and he wrote them down. And he said, this is what we're going to do. And he wasn't wrong in stating any of them. And I know we're going to talk about those in a little bit, but it was very, very powerful. And then I guess following on that, I realized they were offering this class at there's a small college here in Louisville. It's a historic Black college called Simmons College, and I happen to know the person who's head of development there, and they let me know that they're offering a class called the Radical MLK, and said, I think you'd enjoy this class. So I signed up, and Russ Cox and Mike Goff, who's my boss, who's the COO, they made fun of me because every Monday night I'm like, no, I got to go. I got a 6 o'clock class. And they're like, what? They didn't take it serious at all. I took this class very serious. And actually, from some of the papers that I've written, have now, been a face of the class for the college and representing Norton Healthcare in editorials and a lot of different things. So, but it made me realize how much I don't know as a marketer when I take great pride in saying I know my audience, how much I didn't know, and how much I was really appalled at history that I didn't know, that we've all missed. And so just as Black employees within Norton feel like they need to find allies, I know I needed to find people that I could trust, that I could talk to about complicated things. And one of the people that actually worked on my team, a young lady named Cindy Benedict, we were talking about, we're trying to do a program targeted to, we found that, not enough Black moms were breastfeeding their babies. So we were going to do a direct mail campaign, right? It looked like perfect opportunity. And Cindy came into my office, she shut the door. She goes, can I just talk to you about something? I said, what? She goes, do you know why we don't breastfeed our babies? And I said, no, I don't know. She goes, well, because our grannies tell us not to, because back in the days, slaves were forced to provide the nourishment for all children, and sometimes even for men. And she goes, therefore, we choose not to breastfeed. I'm like, holy smokes. How do you not know these things? Yeah. And that was just one example of something that doesn't seem that big, but is really important to understand.
Yeah. And, it's that story, which I didn't know that, so much of this is so important now because, again, we've got these 2 major situations or societal challenges that have just lined up in unfortunate ways, but in sometimes I think fortunate. So that's COVID and the racial injustice struggle that we've had, and that's been elevated since really George Floyd, though of course Breonna Taylor is a big part of that. And now we're having much more, for example, open conversations about the struggle within particularly the Black community around something like vaccines, which is not new. That's not a new thing. But I think it's very safe to say that it is there are no silver linings when it comes to Breonna Taylor or George Floyd. There's nothing positive about them at all. But if out of that tragedy, of those tragedies, comes an openness to really understand the past better and understand these communities better and be able to say, okay, we can't just say, take this vaccine because it's good for you. It's not going to work. We have to understand the history of this with those communities. And I would venture to guess that if those events hadn't happened this year, we would not be having the level of conversation around that with vaccines, as an example, that we're having now. And so hopefully that's how we're building to go forward from those two events that have kind of come along at the same time.
Yeah, I couldn't agree more. I'll just give you one example. One of the things that we're doing, and when we talk about the health imperatives, one of the things that actually fell out of it for me was this idea of how do we build trust within the Black and the Latinx community, and it's really interesting. There was a group here called Play Cousins, and it's a group that says, hey, look, you know what? We are Black people supporting Black people. And they simply wanted a directory of Black providers. And we couldn't do it. It was like, that was not an easy task. It's like, how could that not be an easy task? But it really wasn't. And it's a great opportunity. But another example is last night that we did we didn't do it, sorry. There's an organization called Roots 101, which is basically an organization for Black people to help. They come together to support each other, to learn, to educate. And we had 2 physicians that were on their panel. Now, they were not on that panel because they came from Norton Healthcare. They were on that panel because they were Black physicians. And the moderator was very clear in saying, I don't care what Norton Healthcare says about the vaccine. I want to know what you, as a Black physician, have to say about the vaccine. And sometimes, we can get in our head, oh gosh, Norton Healthcare, we have 50% of the market. Of course, people are going to listen to what we say. We've got all these stories. Look at my share of earned media where I've talked about the vaccine. No, if it's not someone that looks like them telling them the story, I mean, it's important. And it's important to understand that's meaningful. And how do we, identify those people? How do we prepare them to do these events? And it's, this is where marketing takes on a whole kind of a very different role, I think.
Yeah, for sure. Well, you've been hinting at these 5 health imperatives.
Yeah.
Why don't you just walk through them quickly and
Sure.
let folks know what those are? Because again, I think really appreciate you coming on to talk about this and sharing what your organization is trying to do around these issues. Because we know it's a difficult conversation. Oftentimes, we know most health systems are not where they need to be with this issue. And so we have to be able to be open about that and say, hey, we've got room to move here. We got room to grow and improve, but we have to start somewhere. And here's how we plan to do that. So talk a little bit about the imperatives that you guys have worked out.
Well, the first one, which is probably, I would say the one that probably gets the most interest behind it, is the establishment of the Norton Healthcare Institute for Health Equity. And it's actually being led by Dr. Kelly McCants, who is a heart failure physician here at Norton Healthcare, who, when it was announced, came to Russ Cox and said, I know this feels like it's out of my wheelhouse, but this is something I just feel really compelled that I need to lead for the organization. And so Kelly has stepped up, and he has been spending probably the past 4 months just out in the community. He came to us from Atlanta, out in the community, getting to know people, getting to know organizations, getting a temperature check on what we're doing well and what we're not doing well, and beginning to build a team. And that's probably been the most frustrating part for him, is just figuring out who the right people and positions are on that team. And that's not all totally resolved yet, but I've been working a lot with Kelly on some different things. And that's the whole idea behind the Health Institute is we're going to find space in the West End where we're going to have a physical presence. We're going to have a resource center, and we're going to figure out what all it needs. And anything that helps to remove the barriers that we know that are so incredible when it comes to that community having access to care, whether it come from transportation or food insecurity or even education. What can we do within the schools, those type of things. So that's the first one. You have any questions on that one?
No, I would like to encourage people to ask questions. So just going to put that prompt out there again, put those in the Q&A feed for Dana or myself or Chase, but keep going. So,
Sure.
So first of all, an investment right there,
Right.
in something that's significant. I think that your next one is equally important, equally
Right.
significant.
So the second one is this idea of ensuring access to primary care for everyone. And this is really where this concept is funny. You would think this idea of building trust would have come out of the Health Equity Institute, but it actually came out of this work group. So what's so interesting is, which I totally skipped over, and I'm sorry, when Russ announced these, he also put out he identified people that he thought would be important to lead these, and people that had reached out to him at different times, whether it be around some of our employee resource group activities, and assigned some people to the teams, but then put out an open call to anyone who was interested in being on the team. So it was a very, some of it worked and some of it didn't, I'm not going to lie, but it was quite the gesture. Anyway, so in the second one, this idea about how we ensure access to primary care for all, some of the providers that had recently joined us from the University of Louisville, they were actually were probably farther ahead on this. A lot of young pediatricians who really come at things from a whole different perspective. A lot of it because of their age and their interest in kids. It's so understanding. I'm sure a lot of people have heard of the ACEs, or adverse childhood effects, or trauma-based care. They all come from this area. So this idea of how you get kids into care is really important to them. And they taught us a lot about this idea of how do we build trust, and who should our partners be, and how do you identify these partners and connect with these partners, and who are the physicians that we should be using. And so it was actually out of this team that we've identified 4 physicians, 2 that are going to be our faces for the Latinx audience, and 2 that are helping us within the Black community. And we connected with the largest Black church in Louisville, and they have their own TV channel. And Dr. Patton goes on there once a week with a health topic. I've put dollars behind with 2 of our radio stations that serve a Black audience, where we're doing a monthly health topic with them. Things that they're so basic, and you're like, how in the heck were you not doing that before? But we weren't, and now we are. And I think it's really meaningful. So this idea of what does it mean for access and getting multidisciplinary clinics into that West End because of the high comorbidities down there, whether it be with obesity or heart disease and cancer, and you think about how challenging it is for someone who has cancer doesn't have transportation, but has to get out to the East End for their care. And what do we do about that? So we've learned so much through this team. It's been really, really incredible.
Great. And that is a huge issue. Also a huge issue is your third one. And This is where we hear from a lot of people that they get stuck around this topic, Dana, because most everyone we work with, most everyone we talk to wants to do better, wants to speak out on these issues, wants to represent the right way to move forward, but then looks in the mirror and says, "Ugh, we are not reflecting DEI in the way that we should, particularly at the higher levels of our organization." Right. So talk about the third imperative.
It's that I mean, everything you said is right. And when we looked around our leadership table, we looked around what we called we do have a leadership conference once a quarter with about 600 people. But we also had a smaller group, which was the officers and division directors. And that was really the leader group. It was about 70 people that was lacking in diversity. And so we said, we know it's going to be a slog, right, to get people, in the queue and recruited in. But so one of the things we did is we said, you know what, we're defining leader the wrong way. Look at all these diverse employees who are stepping up and leading our employee resource groups. Look at all the diverse employees who are supporting us through special projects. And so we said, we're going to redefine the way leader, anyone who's serving on any of the health imperatives committees, you are now part of our leadership meeting. And it was an incredible, I think, gesture, but the fact that these people can teach up has been really, that's probably the most powerful thing. And just to be able to have access to leaders is huge for these people, and building their allies in order to have people get to know them and know what they're about in order to move them forward in the organization. And that's probably been, I guess, if you talk about low-hanging fruit, that was something that was easy to do, but incredibly powerful. We know that we have challenges within, I mean, just the diversity of people that go to medical school. I mean, we're all out there trying to fight for the same candidates. I think I think less than 7% of our provider workforce, physician workforce. Now, if we throw in nurse practitioners, it gets to be a little bit higher, but is diverse. So, we're reaching out. We're going to have relationships with historic Black colleges. That's one of the things Kelly's working on. We're working with our own universities here within the fraternities and sororities in order to try to develop, workflow, people coming into the organizations. That we're reviewing the way that we do our internship program. I have to be honest with you, our summer internship program was really like friends of leaders. Get the opportunity, and you recognize it's not a level playing field. We're going to level the playing field. So
okay, so we've got two more imperatives left. Let's get to those pretty quick, because I know there's a final question that I want to ask you, and then we have a couple questions that have come through. Sure. So I want to make sure we get to all that. So get to the final two imperatives as quickly as you can, and then I'm going to ask you the most important question at the end.
Yeah, these are really quick. The fourth one was to help employees engage in matters that are important to our community. And that was just helping people understand, particularly during this election period, the importance of voting, the importance of the census, educating people on those things. And then, Affordable Care Act is important to us. This is all, we have to be very careful about all this, but there were, just things where we're saying, and now we'll come to the vaccine. How are we going to using this as a platform to educate employees about important issues, and then hopefully things that they'll feel compelled to take action on. So one was really about educating. And then the last one was that there was a commitment to invest an incremental $20 million into moving these initiatives forward in underserved areas. So a lot of those dollars will flow through Kelly McCann's and the Health Equity Institute, but there's the commitment to get things going.
It's such a great template, Dana, those imperatives. Because again, I think we've worked with a number of clients, we've talked to a lot of people, and they just don't know how to kind of move things forward because it is a really big thing to get your arms around, and it is sensitive. And a lot of folks get stuck because they feel like, well, if we're not embodying these things, can we really even say anything about this? They kind of get frozen a little bit. So again, very authentic and transparent, but just concrete steps, concrete strategies that you're taking, I think is really great that you're able to share that, and great for our audience to hear. What would be, so knowing your role and knowing that the people listening and the people who are going to download later and listen on the podcast share your function, marketing communications, what would you say to them? What is your recommendation to them on how to step up in this area?
If it's kind of weird because I think most people are like me. And so if you're a marketer, I think you're naturally curious and you don't mind asking questions. And so I think the first thing to do is to find people where you can identify those that you can have safe conversations with. It was through our conversations with, I started with our prevention and wellness team who's been out working in the community, but they're so far down, they don't even think about what they're doing as important, that they forget to shine a light on it, and that the relationships that they have that could be enhanced because of the power what the organization could put behind it. So we've identified, different groups that we can connect with through that. Our faith and health ministries team that have relationships with churches. I'd spent time talking to them to figure out where we could begin to build a relationship. And then within our provider network. And, the reason I'm smiling is because Dr. Patton, who has stepped up as one of our key leaders in reaching out within the Black community, I almost feel like I'm his personal assistant now, because it's not a service line yet, right? And we're figuring out how to do things. So when he needs something, he calls me, and most of the content we have is just a matter of how I pull it together and package it for him. So finding resources, to support this is something that's on my checklist to do. But I'm learning so much by being a part of it that I would just say you got to just figure out a way to step into it and not be fearful and be authentic. And I think it's really important. I've got, people that I'm mentoring, and I'm learning more from them probably than they're learning from me right now. It's been really interesting. The class that I took, that radical MLK class, oh my gosh, you can just read to understand. I would say that if you're like, this is like going over your head and you're like not really understanding, that podcast, the New York Times podcast on 1619, it was powerful.
Yeah.
Really, I learned so much in less than 5 hours that I think is really, really powerful. And I do think that it is. If our mission is to provide quality healthcare to all those we're called to serve, if that's what our mission is, then there's nothing more important than to do this work within these underserved areas.
Yeah, and you and I had a conversation with Chase before this, and I think you touched on this a number of times. You just hit it now. If this is something that's important to you personally, it should be to the organization. But if you want to step into it, as you said, and really help lead it, you really have to be open to your own perspectives and open your mind to. It's safe to say that almost everybody in our roles, Dana, has something to learn in this space. And you and I talked about, personally, you and I had a lot to learn. And given where we're from, just coincidentally, we're at the heart of these issues earlier this year. I think we both took, like you mentioned, your class, you can read, but really having to get educated about this, because the more you learn about this, the more you realize you don't know.
Yep.
And I think that is, no matter what you do within the organization, just personally, that's going to help you move through this in a smart way. So we've got some questions. Let's get to the first question. Can you talk a little bit about how you work with local governments to advocate for more health resources? Are you doing that? Are you trying to partner with them specifically? That could be City of Louisville. It could be at some other entity. It could be the state.
Well, I mean, through our government relations team, we have a great relationship with our governor, and so. But that hasn't helped me get incremental resources. It has helped the organization when it comes to things like PPE and vaccine, things like that. I think that when you have the ear, that's helpful. But I think that probably, I'm not sure that I really understand that question so well. I mean, we are partnering with the local health department when it comes to vaccine initiatives. So coming together as a community around some of these things, and this is it's hard because we're in a very competitive market. And so working with Baptist Health and U of L is a little out of our comfort zone, but we know it's the right thing to do. So we're doing some new things in new ways.
Okay. Another question. I think you kind of touched on this a little bit, so maybe it's been covered, but you can expand on it. Can you talk a little bit more about what the organization is trying to do with internal employees, staff, to help educate them on these issues, not just necessarily giving them opportunities to volunteer, which you touched on, but even in the area of maybe you could choose like health equity. Are there things going on to help bring people forward in terms of their understanding of these issues and how they show up?
Yeah, there are, and that's that's really part of what we're going to try to do through imperative 1 and 3 working together. But also it's kind of interesting because every year on for Martin Luther King Day week, whatever it is, we normally will just go volunteer at an organization, a nonprofit. And so we're going to do things like that with greater intent. We have a employee resource group called Synergy, which is for the Black, though not just for Black employees, right? But Black employees and their allies or anyone who's interested. And so this year we're going to bring in, actually it's the Dr. Brogdon, who was the professor in my class, who's going to speak on the radical MLK, and which I think will be really interesting. And we have done early on, we brought in a Dr. Nifley who came and did some cultural sensitivity work with leaders. And then we did an exercise actually through Metro United Way came in, and it was almost like a Monopoly game though, that they played with us, but it gave you the understanding of what systemic racism or oppression has done to minimize the financial access to financial wealth within the Black community. That was really powerful. And we did that with a cross section of them. It wasn't just all leaders, it was a cross section of employees and a very diverse group. It was really interesting. So things like that to help educate employees has been really powerful.
Great. All right, last question here. For those that are looking to try to dive and educate themselves or learn more on just racial injustice or health equity, you mentioned the class, but that's obviously local to you. I have one recommendation. Do you have any recommendations of resources that you've leveraged over the past 6 months that have been helpful to you personally?
Well, I like I said, that the New York Times podcast was probably, it was one of my employees who she's white, her husband's Black, and she said, man, if you haven't listened to this, you should listen to this. And that really kind of lit a fire for me that made me realize I didn't really understand a whole lot. And then the book that they used for my class called The Radical MLK, it was actually, so it's a great book in that it's just, each chapter is just a different, actually a letter or a speech that MLK did. Very, very powerful. You don't have to read it in any certain order, but it was, he really, you get to the heart of what he was about, this idea that, nonviolent resistance with a heart of love can really melt the greatest oppressor. But so much of it has to be one-on-one, because within groups, it's, the power of a group that oppresses you is an awful lot against a smaller group. So, but I think that's where, it really takes he has a harsh voice for healthcare, and rightfully so.
Yeah. So just a couple of recommendations from my own journey on this. There's a podcast, I don't know if you've heard of it, Dana, called Seeing White. It's from a few years ago, actually. You can probably find it on iTunes or wherever. I think I'm not sure who produced it. Seen on Radio is the name of the producer. It's a series. It's really, really amazing, really well done. So I'd recommend that. And then I know this sounds cliche, but I did read a lot of books. And the one that still stands out when people ask me this question personally, the book Stamped from the Beginning by Ibram Kendi. I don't know if you've read that one. That one is the one that opened my eyes and dropped my jaw the most in terms of, wow, I didn't know bleep about racism and racial justice in this country. And it is, I like history, so it's helpful for that, but it doesn't matter whether you like history or not. It's very much worth reading if you want to invest time in learning more about this. It's a great place to start. There's plenty of other resources, and I'm sure people, can look those up, but those are the two that had the most impact on me. So yeah, this has been fantastic, Dana. We so appreciate you being willing to come on and talk about this, share what's going on at Norton. Just so helpful, I'm sure, to others in the industry to hear what's going on.
Well, I appreciate being here, and thank you everyone for joining. And it's good to see both you and Chase.
Yeah, absolutely. Chase, thank you, sir, as always.
Absolutely. Yeah, thanks. Enjoyed the conversation, and always good to see you, Dana.
Thank you.
Please let us know if there's something you'd like us to cover on the show. You can post that right in the chat function of Zoom right now. You can shoot us an email at nonormal@thinkrevivehealth.com. Next week, we're going to be continuing this conversation to some degree with Adam Brace, who's the head of strategic intelligence at Mayo Clinic. They have a lot of resources they dedicate to futurism, to trends. The topic that we just talked about with Dana is definitely something that they've been studying. So he's going to come on and talk about some of the things they do, some of the things they see coming down the road. Pretty fascinating stuff. So really encourage you to come back for that. Remember, you can subscribe to this on iTunes if you don't already. You can, by the end of today, see a recording of today's episode at thinkrevivehealth.com. And until next week, hang in there and good luck out there in the no normal.